Ready to go. Perfect. Nice. Yeah, that set really nicely.
Yeah, that felt really good.
Yeah. In regards to the sciatica, I know you said you do get occasional. Is it occasional or is it pretty consistent back pain as well?
Pretty consistent.
Okay, where do you feel the back pain? And then let's separate from the sciatica. So you do feel it right in that lower back area here. Okay, but the sciatica, you are feeling it into the glute.
Yes.
And that's where it starts.
Yeah.
Okay. Do you notice that when your back pain aggravates or gets worse, that this gets worse too?
Yes.
Okay, so you are noticing that as well. But at this point, the sciatica is not really as much pain anymore as much as it is numbness.
Right.
Okay. And the numbness, you said it goes from the back of the thigh into the feet. Is it into the toes as well, or is it just...
And you know what? Now it's just in my toe.
Just strictly in the toe now?
Right. Like, starts from here and then from here.
Okay, so just from the ankle then?
Yeah.
Okay. All right, but you are still feeling back pain?
Yes.
Okay, so let's talk about that then. Can you do me a favor? I want you to stand up for me. I want you to reach down towards your toes. And I want to see if there's any increase in back pain. Any pain down that?
Yeah, I feel back, but I mean, I could tolerate it.
Okay, okay. But there's pain. It's tolerable, but it's pain.
Yeah.
Okay, what about if you arch back? Are you able to arch back? Any pain with that?
A little bit.
A little bit? More so when you're bending forward?
Yeah.
Okay, okay. So when you arch forward like that and you get pain, what we're doing is we're stressing the joints, right? So think of it like a water balloon. If it's wide like that and if you reach down towards your toes, we're compressing the front of the disc and it pushes the disc back towards that vertebra or that nerve. And that's kind of what it happens. So when you're bending like this, it's squishing the disc and it's compressing down onto that nerve, so that's where you're feeling more of that pain. When you do the opposite, where you're extending like that, which is going to be a good exercise for you just to get some extension, that's going to help to push the disc forward and away from that nerve. So I know you said the sciatica, that was about a week and a half, 2 weeks ago?
Yeah.
Okay. But I know you said the first initial onset was about 5 years.
Yeah.
Okay. You said that there was something that came up. What happened, or what started it 5 years ago? Was it that you just went to bend over, pick something up?
Yeah.
Or
Playing baseball, I think.
Baseball?
Yeah.
Okay. The back pain, is that 5 years ago as well, or do you feel like that's been longer?
I'm gonna say 5 years ago as well.
Okay. Right there. Let's see here. What kind of leg workout are you doing?
Well, I was doing lunges and I was doing when you get the 80-pounder and just go all the way down.
Like a squat?
Like squatting.
Okay, nice.
But that stopped that real quick.
So you said that you lost all this weight within 2 months?
Yeah.
Okay, and then the pain, you stopped working on it after the pain started coming in?
Yeah.
Okay. Yeah, so right over, this is your L4 area. That needle is just pinging right where that L4 is right there. So I would think this is where we're going to really focus on right there. And hopefully once we get this to stabilize and get some pressure off of that, I do want you to go back to working out again. Yeah, I want you to do that. So once we can get this to stabilize, then we'll hopefully get you back into working out again. C7, oof, that doesn't move very much at all right there. T1 and 7, which is the most tender, if any. It doesn't have to feel tender, but any soreness there. Or T1. C7, T1.
T1.
T1 a little bit more. 4, 3, 4. Any soreness or tenderness there?
4.
4. Alright, so we're going to work on 4. I'm going to rescope this and see if we're going to work on T1, because these ones are pretty close together. Usually if we work on one, it will improve or affect the other one as well. So we're going to take a look at how that responds. 5, 4. So that 4 definitely doesn't move very well. Any pain with that?
It's stiffness, I guess.
Stiffness, yeah. I know we talked about last time you have a pretty high pain tolerance.
Yeah, it's really hard to tell if I'm feeling pain. I just feel stiff.
Yeah. So we're going to start with L4, just because it's slipped back, it's pinching down on that one. We're going to see how you respond to that. If that's starting to do better, we're on the right track. Sometimes I still need to do L5 to stabilize that underneath it, but because it's slipped back so far, we're going to get that and try to push that forward. Okay, so we're going to do that L4, and we're going to do your T4, and then I'm going to scan your T1 to see how that's doing. 5, 4, 5, 4, right there. All right. Wait just a bit. I won't drop you. Don't worry. All right. So all you got to do is relax that shoulder and give a bit of a push right there. Okay. Let it go. Perfect. Nice. Good job, man. Coming up.
I feel really good.
Yeah, let's get you walking on that. So come on over here. You're just going to walk to that table, walk in there and back. Yeah, that's set really nicely.
Yeah, that felt really good.
Yeah. It's going to get nice and slow, okay? There you go. All right. Take a deep breath for me. All the way out. Let it go. Relaxing the shoulders. Nice. Well, that's set really nicely. All right. Let's get you walking, man. Yeah, so we got some movement on that one. That one moved really well. So let's see if we can get some movement, get some walking off on that. So basically your posture, it tends to hunch over a little bit more.
Yeah.
And so I can tell those muscles are really tight around that area. It's looking pretty good up here. Let's see here. Yeah, that's set really nicely. I think we're going to leave that alone. Good. Okay, so that's looking better too. So we're going to see how that does. I'm going to lean you back a little bit here. I just want to see how that's moving here. Lean you back. Much better. Yeah, do you feel like how it glides forward now?
Yeah.
Before it was stuck. It was really
it wouldn't let me.
Yeah, so we're actually getting more movement on that. Because this joint, when you go forward like that, it's going to put that pressure on that disc and put stress onto there. So if you have to, pick something up or reach down for something, that's where you're going to start seeing some stress. Even if you have to bend over to tie your shoe, that's where you're going to see some of that stress. So if you have to tie your shoe, I'd recommend doing it like this so you can sit up more upright, and then you can tie it like this or put it on something where you can kind of keep your back straight. At least for the meantime, while we're trying to get this joint to heal, I want you trying to avoid that. But I want you to start doing a little bit of an exercise where basically we're trying to get some back extension. So where you're just kind of letting your belly sit forward and letting your pelvis rock forward. And as you do that, and you can even look up a little bit because that will help your mid-back as well. But you're just kind of letting that belly kind of go back and back, basically to forward, to neutral. I don't want you to go too far up and then you're going to slouch down. I don't want you to do that part. Allow your belly to go forward and then just go back to neutral, forward, and then neutral.
So like this?
Yeah, that's exactly what I want you to do, okay? And so especially if you're sitting for some time, I don't want you to sit stagnant. And try not to do any slouching right now, just because when you slouch, what happens is you kind of slouch like this, and that puts stress onto that lower back. So if you have like a small pillow, like about the thickness of like this here, like maybe a couple inches, that's enough to kind of get that arch to support here. Okay? Because we talked about how in your spine, you've lost a lot of that curvature. And so with this, if you sit down, and if you're not able to maintain that and you want to kind of relax a little bit more, get a small pillow and then just allow that to push your spine forward. Okay? But that will help to ease up some of that tension and keep that joint shifting forward. Okay? And then the last thing is, if you can, actually two more things. One, get some walking. Okay, walking, like I said, going back and forth, it gets some of the inflammation out of there, because now that we got repositioning of that joint, movement is going to help that joint to get some inflammation out. And then the last thing is going to be ice. Okay, 15-20 minutes. If you can, get an ice pack, paper towel around it, and ice that area for me. Even the mid-back, we got some good movement on there, so you can feel some soreness with that. So ice is your best friend right now. Okay. Other than that, how you doing?
I'm doing great.
Okay. Good job, man.